stepped on your your shoes. So the room is still safe, and I'm going to put those in the closet as soon as we're done with our assessment to maintain the room being safe. The curtain is still pulled. My hands have been sanitized one more time. And we're going to do S1 and S2 heart sounds. Okay. So what I'm going to do first is find the aortic valve. And that's going to be the second intercostal space on the right-hand side. So I'm going to do that with the diaphragm of my stethoscope. I'm going to check that it's on. It is on. Just put this pen in my pocket. Okay, can you sit up a little bit more for me? I'm helping my patient get to a dangling position. So you could lean back, put your arms on your, wonderful. So I'm going to find the clavicle, and I'm just going to go down from there to get to the second intercostal space. And I'm going to listen to the aortic area. Okay, just try to breathe normally. Wonderful. So now I'm going to go on the other side, to the left side, to do the pulmonic or pulmonic area. I don't hear any murmurs. It sounds good, rhythmic and normal. Okay, so from there I'm going to go to the lower left from the sternal border. So this is your sternum. So I'm going to go on the left side of that, and I'm going to go right, here's the sternal border. I'm feeling for it. I'm very sorry. So okay. This was the second. So I'm going to feel, this would be the third, and there's the fourth. So now I'm going to listen to the mitral valve on the left-hand side. Hang on a second. Nope. That's why. Sternal border. There we go. Let me fix your shirt here. Okay, I can hear your tricuspid valve. I don't hear any lagging, no murmurs, and it sounds good. Next, I'm going to go to the mitral valve, which is going to be on the mid-clavicular line, so on this side of the clavicle, and it's going to be the fifth intercostal space. That was 4, because of right here, that was 4. So that means down a little bit lower is going to be 5. So I'm just going to go right here. I'm going to move from side to side to see if I can hear it. There we go. It sounds good. Alrighty, so next I'm going to do breath sounds after that. So there were no murmurs, no abnormalities. It sounded very good. So now I'm going to do your breath sounds. Okay. And that's going to be on 3 spots on bilaterally going down your torso. So I'm going to do the anterior side, and then I'm going to do posterior. So I just want you to breathe normally for a moment. So I'm going to start up here.
Okay.
The ABCs. Go ahead and breathe in and out normally. I'm going to go over to the other side. I'm listening for an inhalation and exhalation. So I'm going to go down here. Very good. And breathe in for me. Very good. Okay, I'm going to go over here for the third. Good job. Wonderful. So now I'm going to go on your back and do it posteriorly.
Okay.
You can prop your feet back up on the bed, please. And let me fix your call light if it were here. So it's still there. Okay. So I'm just going to do this one more time on your back. Okay. Inhale, exhale. Breathing normally. Very good. I don't hear any wheezing. I don't hear any bronchi. I'm going to go down here. Okay. Alrighty, very good. So next, I don't see, pretending his shirt is off. I don't see any skin abnormalities. I don't see any malformation with his spine. I'm going to feel for any protruding nodules or anything like that, any vertebrae out of place. Very good. Thank you. You can sit back and relax. Okay, so no skin abnormalities, no spine structures that are abnormal. So next I'm going to do his abdomen. And with this, I am going to have to lift your shirt just a little bit.
Okay.
But can you tell me when your last bowel movement was?
This morning.
It was this morning? Wonderful. Is it mostly in the morning?
Yes.
Would you say you're pretty regular?
Yeah.
Wonderful. How about you going to the bathroom number 1, like peeing? Would you say that's pretty normal?
Yeah, about 5-6 times a day.
Wonderful. So you mentioned your medications. Are you on any medications that might make you go to the bathroom a little bit more?
Yeah.
So how many times a day do you pee?
About 5 or 6.
Wonderful. Okay, that sounds about right. And you are drinking enough fluids?
Yeah.
Good. So I'm going to look at his skin when he pulls up his shirt. I'm going to oscillate his bowel sounds on the different quadrants. And then I'm going to palpate each quadrant to check for pain. And then I will oscillate the epigastric area near the aortic area. Okay, so listen to bruit to see if there's any signs of bruit, which may mean impaction or obstruction. Okay, so I'm just going to lift your shirt with my clean hands, and I'm just going to actually have you, lean forward a little bit. I want you into a lying position a little bit better. So go ahead and lay back. That's it. Perfect. I'm just going to lift your shirt a little bit. And I'm going to start with the first quadrant.
Okay.
So that's going to be on the right-hand side on the upper epigastric, I guess, or upper quadrant. Okay. So I'm just listening to your bowel sounds to see if it's moving. And this could take upwards of 5 minutes. Nope, I heard it. It's moving. It's kind of a little gurgly sound. So I'm in the second quadrant. Yep, I'm hearing movement. I'm going to go to the third quadrant. Okay, I hear movement, gurgling. Okay. There we go, I hear movement. Okay, so next I'm going to check his epigastric area over the aortic area. So the aortic area is on the right-hand side of the body. This will be anteriorly. And I'm looking to hear for bruit. So I'm going to use the bell of my stethoscope. Hang on, let me turn it on. I do not hear any whistling. And I hear movement. Very good. Okay. So, do you have any issues, like with your reproductive organs? Any, have you had a check recently? Do you check your scrotum for testicular cancer?
Yeah.
You do? Okay. And you know how to do that, correct?
Yes.
Do you want a brochure or anything to kind of give you a step-by-step on how to do that and what you're looking for?
No, I'm good.
You're okay. Okay. Do you have any questions or discharge with
No, not at all.
Okay. So next I'm going to do his upper extremities, and I'm going to inspect his hands, his arms, his shoulders, skin, range of motion, feel for his radial pulse, and capillary refill. So I'm going to see this arm right here. I'm going to see if you could raise it all the way up. We're going to do range of motion first. Get the blood pumping.
Mm-hmm.
I'm going to have you bend your elbow. Do you have any pain?
Not at all.
Any discomfort? No discomfort?
Not at all.
Okay, and that doesn't hurt, right?
Nope.
Okay, so I'm just going to look at your fingernails. I don't see any discoloration at the cuticles. I'm going to press his finger. Capillary refill is almost instant. It looks like you bite your fingernails. Do you want some brochures on anxiety or how to deal with maybe not biting your fingernails?
Yeah, that's fine.
Okay, sounds good. So I'm just going to check your radial pulse. Okay, let me check this arm. So we're going to do range of motion again. We're going to lift over the head. There's one, and we're going to bend at the elbow. Any pain?
No.
We're going to go one more time, okay? And no pain, right?
Nope.
Good. So I'm looking at your fingernails again. No discoloration. And I'm going to do capillary refill. Very good, almost instant. I'm just going to pinch right here and see if it snaps back.
Okay.
That means your skin integrity is good. It's elastic and you're not dehydrated. Beautiful. It snaps right back. Next I'm going to check this radial pulse, so we're going to lift. Good. Okay. Then I'm going to do, let's see, the lower extremities, which is the heels, feet, calves, thighs, hips, I'm gonna check his skin, and then